Welcome back to Aging is for Everyone. We're talking about the Buffalo Niagara Medical Campus today. In our last segment, Pat Whalen mentioned a little bit about their Healthy Communities initiative. And here to tell us more is Jessie Hersher Gouck, the project coordinator of the Healthy Kids, Healthy Communities initiative. Welcome, Jessie.
Thank you. Thanks for having me.
Thank you for being here. Healthy Communities for Kids is so important. How do we go about making our community healthier for kids?
Well, what we are working on at the medical campus is something called the Healthy Kids, Healthy Communities initiative, and that is actually a grant program of the Robert Wood Johnson Foundation, and it specifically is looking at how we can make policy and infrastructure changes within our communities to make them healthier for youth and families and really people of all ages. What we're focused on in that initiative specifically is healthy eating and active living, so taking a look at how we can make changes that are sustainable over the long term that really make it easy for people to thrive and be healthy where they live.
Can you give me an example maybe of what types of policy changes you're talking about that would make the community healthier?
Absolutely. So when we're talking about something like active living, we're hoping that people are able to get out and walk to work, walk to run their errands, walk to the grocery store to get food. And a type of policy change that we work on here in the city of Buffalo is the Complete Streets Ordinance. So when I say complete streets, I mean we want a street in the city that is user-friendly for all modes of transportation. So we don't only want to accommodate the automobile, we want to accommodate someone who rides their bike or who chooses to walk or takes public transportation. So in the city of Buffalo, we actually have such an ordinance that says that as we move forward with revising and rebuilding our existing streets, that we will make them user-friendly for all modes of transportation. So something that we would work on is instilling policies like that in the city and then also enforcing them. And so how we work on the infrastructure side of those policies is saying, okay, we really want to work with the city to make sure that if they are going to redo a street, that we do see striping for bike lanes, or that we see new curb cuts on the sidewalk, and that we see ramps that are accessible for all users, whether it's children, elderly, or people with disabilities.
So some of the things that you might be looking at are also, obviously this show is Aging is for Everyone, so they don't just impact children, they impact everyone.
Absolutely. Actually, it's nice when you plan for children or you plan for an aging population, you're actually doing the best for your community that you can, because children and older populations, they really have a greater need for different types of infrastructure when you're building out your community. So an example would be really nice lighting on a street that's at a pedestrian scale, not, you know, the sort of highway overhanging lights. Or you're talking about having benches that are spaced very nicely. So not only is it a nice place to rest, but if someone, you know, needs a break from walking, there's ample seating that makes people feel comfortable and also creates a nice atmosphere on the street where people would like to be.
Right, that's great. That's great. Now you also mentioned healthy eating and active living are a couple other focus areas. What are you doing around those focus areas? So
for healthy eating, we're really looking at making the healthy choice the easy choice. So what we're saying there is we're hopeful that we can make it so every community in the city of Buffalo, every neighborhood has access to fresh, affordable, really culturally appropriate food within their neighborhood. We have lots of supermarkets in our region that are great. We have Tops and Wegmans spread all over, and they do a really nice job. But they are disproportionately in our suburban areas, not in our cities. So we look to a variety of different strategies, policy, and through corporate and private partnerships to see how we can make the inner city have more opportunities to have fresh food. So that includes getting fresh foods into places like pharmacies or drugstores, something perhaps like a Walgreens. There are models all over the country where Walgreens or Walmarts, we don't have one in the city, but places like that that maybe wouldn't traditionally carry food, to carry healthy, fresh food to serve those neighborhoods.
Right, right. It seems like it's always easy anywhere to get junk food, but trying to get the healthy food is really what we have to work on.
Right, and currently we're working with the City of Buffalo and Erie County on the creation of a food policy council. So we're really looking to help our local governments to learn more. The issue with healthy eating is there is not a department of food in any sort of local government from a policy perspective. So we're looking to create a panel of experts that can really help our policymakers make informed decisions about how to create healthy places and healthy food access for all people within Erie County.
Now, what else does the future hold for this type of program, the Healthy Communities in the Buffalo Niagara Medical Campus?
Right. Well, beyond the life of the Healthy Kids, Healthy Communities initiative, the Buffalo Niagara Medical Campus is looking to really expand our work in this area, and that can mean lots of different things. I mentioned private partnerships. There are opportunities to partner with grocery stores, with healthcare providers, with schools, with all types of organizations across the spectrum to really look at health in a variety of different ways. In the workplace, worksite wellness, creating opportunities for people to be healthy as they commute to work. There's plenty of opportunity within our schools to look at how youth get to school and also what they do while they're there, what they eat while they're there. And then looking to bring in some of our our large institutions within the community that we hope will feel a sense of stewardship to the populations that remain here. Pat mentioned that we really would love to have a vibrant world-class city here in Buffalo and all across the Buffalo-Niagara region. And to do that, we all really need to be vested in each other's health and wellness. And so our ability to work together through programming, policy change, and really changing the neighborhood from the ground up, we can do wonders, and there's great opportunity here.
Wonderful. Wonderful. Well, thanks so much for being here to tell us a little bit about this initiative.
Yes, thank you.
And people can go to your website and find out more.
Absolutely. Thanks.
Thanks so much. We'll be right back with more Aging is for Everyone.